So shalom, good afternoon, good evening, and good morning, depending on where you're following this meeting from. I'm really happy to see that we have participants joining in from all over the world. To all of you, welcome to this Bayer Israel initiated event on digital health. My name is Hugo. I'm the Managing Director and Country Division Head for Bayer Pharmaceuticals in Israel, and I will be the facilitator for this meeting. So we started planning this meeting in the middle of the COVID pandemic, but we did not want this meeting to only be about COVID. The revolution in digital health started long before COVID. It may have accelerated during COVID, but the enormous innovation and changes we are witnessing will for certain continue long after COVID is gone. But in order to drive innovation and change, we need innovative people with an entrepreneurial mindset who are willing to set the agenda and lead the way. And today, you will meet some of these people. Sean Karen, Senior Vice President of Digital and Commercial Innovation from Bayer is here. You will hear from Sigal Rosenberg, who is the CEO of Mohedet, one of the 4 Israeli sick funds. Eyal Simlichman, Deputy Director, Chief Medical Officer, and Chief Innovation Officer at Sheba Medical Center here. And also, in addition, 2 great representatives from the innovative Israeli ecosystem, Kira Radinsky from Diagnostic Robotics, and also Eyal Baum from TytoCare. We're moving on in the program. I'm getting really exhausted here because, there is so much information to take in, fantastic speakers, and I'm sure we could have given them a lot more time to dig into their topics. We have one more speaker left for tonight, and you heard the company's name being mentioned several times already, and that is TytoCare. So TytoCare is the next company that's going to be presented here, and it represents, it's one of the most advanced and successful Israeli companies in the area of home health technology devices and telemedicine. So, TytoCare, and you saw some example, their solution enables remote medical exams of the lungs, the heart, the throat, and ears, and just to mention a few examples, and you will see more. In addition, at this point, Tyto is also exploring how to introduce new advanced product capabilities, including AI and machine learning-based home diagnostic solution. Eyal Baum, which is going to speak next, he's the Director of Strategic Accounts at TytoCare. And Eyal, please, the word is yours.
Hi, everyone. Thank you, Hugo, and definitely an honor to present our company and product in this webinar. So I'll try to briefly go over our company, our product, our capabilities, and a glimpse about our activities in the different markets. Just as background, telehealth, as previously mentioned here, is definitely maybe the hottest segment, hottest trend now today in healthcare, especially after COVID. You see the numbers here; they are growing rapidly, and anyone as expected, a year ago. But beyond very higher adoption, we also see a change of regulations in favor of telemedicine. We see governments, not only the US, which is, let's say, the most advanced in this aspect, but also in Europe, in Asia. We see everywhere government, Ministry of Health are changing the regulation to increase the adoption, to allow treating more type of conditions and reduce the barriers to adopt telehealth. And also we see reimbursement for telehealth changing in everywhere in Europe and in Asia and in Israel, of course. But eventually, if you look at telehealth, today, especially with COVID, everyone has done a everyone has done a phone call with a doctor, probably also a video with a doctor, and those are, let's say, the traditional methods to communicate with a provider, with a physician remotely. But if you look eventually on this encounter of just video or phone, it's very limited to what you as a patient or what you as a doctor get if you go to a physical clinic. And Tyto is trying to bridge this gap, to really replicate what you as a doctor, what you as a physician get in a virtual encounter. Because this gap leads to a lack of trust. And we see that eventually, although, the potential is great and everyone are talking about it and definitely see this is the future, but if you look today, whether patients are using that, it's still limited. And doctors are not feeling confident enough to provide the full treatment. And this is exactly where Tyto comes in. Tyto is trying to provide the doctor, when he's doing a phone call or a video call with the patient, to also add another layer to this virtual visit of the examination, the physical examination. What all doctors have capabilities in a clinic, now they are not feeling they are limited. They don't need to guess. They don't need to the patients don't need to feel they are compromising on the level of care they are getting remotely. And this really enables to save completely the visit. Okay, so not in 100% of the times, of course, but it's not just initial consult until you get to the clinic, but really saving the encounters. And of course, saving the cost for the payers, for the insurance companies, and for the governments. So it's basically a kit of connected devices. It has a digital stethoscope that allows heart or lungs or even abdominal auscultation, listening to the sounds or measuring heart rate. It has an otoscope to look at the ears, examination camera with a tongue depressor to look at the throat, and a skin camera, non-contact thermometer, and optionally, if needed, we can integrate with other off-the-shelf sensors. Of course, the entire product is FDA cleared, CE cleared. It's a medical device for diagnostic purposes by all means. In addition to the devices, we have a full end-to-end platform. Okay, so it's not just the connected devices. It's in order to provide the doctor a real confident and intuitive and seamless experience, and also for the patient, you need our platform. So the doctor can get remote control of the devices. Keep in mind, Tyto is not just vitals, it's qualitative examination. So you need videos and sounds and images, and it's basically an examination done by two, both by the remote physician and by the patient or the nurse, if it's done on a real-time usage. Of course, it's HIPAA and GDPR compliant. We are, of course, aware of data privacy and security. This is an essential part of the system. There are customers that already have a platform or wanted to integrate into the medical records. So, of course, we have a very flexible API to integrate into other platforms. So in terms of the experience, how the examination is being done, we support two methods. One is online live as part of a virtual consult, as part of a video call, or offline asynchronous, where the patient is collecting the data, and using our AI capabilities, we allow anyone, not just health professionals or nurses, to capture this data in diagnostic quality, but also consumers, patients who usually don't know how an eardrum looks like, or how the tonsils look like, or how to capture high quality sound of the breathing sounds or heartbeats. So this is why we have invested a lot of development efforts to allow anyone to do a physical exam from home. So just to give you a notion, what does it mean? So let's say a mom has a kid with a fever and some ear pain. So beyond having our mobile app explaining and teaching the mom how to do it, during the examination, we provide image-based processing that guides us through the canal and also confirms that the eardrum was identified, so the doctor will be able to really provide treatment and diagnosis based on this video. And same goes for the throat. So we need to make sure the kid opened the mouth wide enough and said, otherwise we will tell it to do it again and use the tongue depressor. So we verify that the data collected in the offline, the asynchronous mode, will not result in some disappointment, but really allow the doctor to provide treatment when he's getting it offline. And same goes for the stethoscope. You see, we provide ongoing feedback on the quality of the sound. This is the green indication, or otherwise we will give notification to the user whether he needs to improve the sound, keep quiet, and improve the examination. So this was the example of the offline mode. This is the online mode. This is what you see as the doctor side, okay? So you as a doctor are performing a video call with the patient, and in parallel, you are getting in remote control of the device. So when the patient is placing the stethoscope on the chest, the doctor is getting real-time sound from the patient's heart, from the patient's lungs, or even abdominal sounds. It can get the heart rate. It can apply filters if you had some noises or want to amplify the breathing sounds. And if needed, you can select a different point, which is automatically reflected on the patient side. So you You see back then in the stethoscope, now it's on the examination camera. You'll see in the ears. We provide the doctor a very confident, intuitive, and easy to use experience. So he will not need to be very tech savvy. He will not to get too much training. And we know that experienced doctors do Tyto visit today. I mean, the entire session, including documentation and explanation, everything in less than 5 minutes. So we see that doctors are managing to do full physical exam in a virtual consult. And really, we have also statistics saying that in 93% of the times, doctor reported that they didn't need a physical visit afterwards. And this is based on thousands of surveys. So we really see that there are evidence that it's not a temporary solution, but it's really replacing the physical visit. So here you see just example of the common condition for primary care. So we are more targeted for primary care, for pediatrics, but there are certain customers that also use it to monitor certain chronic condition. You see an example, but of course it's not limited to these conditions. We have basically two product lines. One is Tyto Home, more for home use. You can see an example, chronic patients, elderly, COVID patients, and Tyto Pro, which is more for clinic use in pharmacies, nurses that are doing home care, care homes, school, ambulances. By the way, Israel National Ambulance Service, MADA, MDA are also using Tyto. So each customer eventually uses Tyto in a little bit different mode. So we are already have good adoption and footprint globally, mainly at the US, but we see expansion in Europe, in Israel, of course, with Clalit, Sheba mentioned here, and other HMOs, Asia, and you see eventually who are our customers, our partners. You see a lot of health systems, hospitals, health insurance, and clinician groups. I want to show you last video before we are ending, a video from Sheba. We can go back. Any chance you can go back? Hopefully, let's give it a try. Previous, and if not, let's do one more try. Now I will, maybe because of the remote monitor. Never mind. This is an example of Sheba who used Tyto for home hospitalization and monitoring COVID patients. That shows how an online visit in Tyto. Basically, Sheba has used Tyto as they began with the patients, the Israeli patients that came, now it's starting from the Diamond cruise ship from Japan. But since then, they're using it both in corona department, pediatric corona departments. Never mind, I see it's not running, but it's okay. Okay, it just will give you, okay, now it's moving, perfect. Sorry for that. So this is basically allows the remote monitoring of patients at home. So COVID patients with only mild symptoms that do not need to take a hospital bed. So they can get a Tyto Home kit to their homes to allow Sheba doctors to monitor them and make sure that they're not taking too much risks by sending COVID patients to the homes. So the patient, and you see anyone can do it, logs into the app, gets online in a video call with the remote physician. The physician sees the patient first, then he can connect to the Tyto device, measure the vitals like temperature or heart rate or blood pressure. And in addition, if the doctor feels he needs some examinations like the lungs, the throat, the ears, etc., he can make sure that the lungs condition is not deteriorating and the patient do not need to come back to the hospital. So that's, as we see it, gives Sheba and other hospitals the confidence to send more patients to the home, saving costs, saving beds, without taking risk of maybe sending patients who can get into a more serious condition without the proper monitoring. So you see here, it's a very interactive live examination between the patient and the doctor. So the doctor, you see the doctor's side, they see the throat, take the temperature, now the stethoscope, and listening to the lung sounds. So patient just put it on the chest. The doctor in his headphones are listening to the breathing sounds and can identify if there are some wheezings or crackles or either indication or not, or rule out any pneumonia or other clinical condition. So this was an example of the Shiba, how they use it outside the hospital, but as I said, also within the hospital. And let's slide another example from a hospital in Switzerland called Freiburg Hospital. They have a team of nurses, about 20 or more nurses that are going to care homes, to patients' homes, really to monitor those conditions. And if patients are requesting for remote physical exam by a physician. And we have, of course, many other hospitals in Italy, France, UK, and US, and other places. Thank you.
Thank you. During your presentation, I told myself, Hugo, you have to stop using the word science fiction because it's not science fiction. It's actually here already. But what you're showing is simply amazing. I want to ask you a question. So there are so many providers out there now, and you received recognition from Sheba, from the Sikfram, from Mohedet, from Clalit. What do you think distinguishes you from the other providers of these kind of solutions out there? What is the key success factors of TytoCare, if I can ask you?
Sure. So as I briefly mentioned in the beginning, telehealth is very widely used today, but it's mostly based on the phone and video. Once you have that additional layer, we call it the third generation of telehealth, that the really capability to do a physical exam is what differentiates us, is what makes us unique, and the capability to allow anyone. So there are maybe other digital stethoscope on the market that you can integrate into your platform, or maybe even a digital otoscope. But first, the comprehensive kit that all these basic tools, basic clinical tools are provided, together with the platform that guiding the patient and provides very intuitive user experience for the doctor and for the patients, allowing to achieve really diagnostic quality data. And this is not easy. Keep in mind, it's not just temperature or blood pressure, that it's a click of a button. Doing a throat exam or ears exam or lungs exam or heart exam, it's not very simple. It's not a click of a button. You do need to find your tonsils. You do need to find your eardrum, or making sure you're not creating noise to the stethoscope sound. So our AI and algorithms definitely makes a difference to achieve diagnostic quality data.
Fantastic, Eyal. Thank you so much for your presentation, and thank you for joining us tonight. And I'm sure we're going to hear a lot more from your company going forward. Thank you.
Thank you.
So, ladies and gentlemen.